I wanted to talk to you about this, actually. Omar runs an abortion clinic in Ontario. Global News agreed not to reveal his last name or where he works. It says Ontario is committed to revisiting the current framework for funding insured surgical abortion services. Have you heard about this?
Not at all.
Part of Ontario's promise is to consider how its potential changes could affect abortion providers. Global News interviewed several staff members from abortion clinics in the province, but none say they've been contacted by the government.
I try to be optimistic. Maybe they're busy.
Until you brought it to my attention, I have not heard about this.
Carolyn Egan has been advocating for abortion rights in Ontario for decades. She says that she's been left out too.
Those of us who are in the field are always very cautious about decisions being made at a level higher than ourselves in many senses, without input from people on the ground who are providing the service.
There's a reason Ontario had to come up with this plan, and the details are in the latest Canada Health Act annual report. Around 2018, the province found out one abortion clinic was charging patients illegal facility fees. This to pay for an aspirator, equipment used to remove pregnancy tissue. Patients gave nearly $14,000 out of their own pockets over a year's time. Abortions are covered by Ontario, and it's illegal for healthcare providers to charge fees for insured services.
It seems like it was something that was a mistake that was then corrected.
That clinic received no extra money from the province. It's also stopped at surgical abortions. But in reaction to this case, Ontario made a commitment to Health Canada last December. It would consider funding all surgical abortion service providers and facilities.
Certainly, those services that are providing abortion should be funded equally, and that's not the case.
Right now, the province fully funds only half of its independent surgical abortion clinics.
If we're not getting that kind of funding, we are definitely threatening access and the existence of clinics.
In an email, Global News asked Ontario why it has not reached out to clinics directly. A health ministry spokesperson responded, but did not provide any details.
I'm just hoping that they do, in truth, listen to those who are in the field, to those who are seeking abortions, and those advocacy groups that have been working for so long to provide adequate access.
Workers on the front lines are desperate to be heard.
Please reach out. We would love to come up with a better way to implement like funding and provide services for women, because at the end of the day, that's honestly the only thing we ever really cared about.
Determined to do whatever they can to continue giving this life-changing care. Jasmine Pisano, Global News, Toronto.